Good morning and welcome. Today we are talking about the pelvic floor, and you'll see in the body of this post that there are a couple other links. One toward toilet time, truly about evacuating your bowels, but also one that introduces you to the pelvic floor and takes you into an exploration of the pelvic floor. For this particular clip, I want to take you through a number of different aspects that can be contributing to and correlated to the way your pelvic floor feels. As we know, we can have direct trauma to the pelvic floor, particularly during childbirth and from pregnancy and other aspects of life. And so there might be, in your scenario, direct trauma to this particular area. There also might be a holding or a limitation in your pelvic floor because of other things that are going on elsewhere in your body. So things in your feet, for example, or in your guts, or in how the way that you breathe, or if you're holding in through your rib cage or through your jaw or through your face, or even headaches that you experience can be related to what's going on through the pelvic floor. So with this clip, I more so want to introduce you to some of these relationships, or not the relationships, but through exercises that might help you see more of the relationships between these parts of you, and you can start to put together some of your own puzzle pieces. What I have in my hands here is a pelvis. So we've got the front, we've got the back, these two hip bones, and the sacrum. And then if I turn it and face it this way to you, we've got the pelvic floor. You can see that it's a diamond shape with two sitting bones here in the front and the back. Now, what's important here in my mind with this particular series is that we've got a floor that also has orifices. So the pelvic floor has orifices for the passageway of fluid and matter, and that needs to allow for exactly that, fluid and matter. So it needs to be open, but it also needs to be strong because it is the floor of our torso. So I like to use the word supple. We want it to be responsive. We don't want it to be overly tight. We don't want it to not be. We want it to find a nice, responsive, happy medium given the function that it's serving, and how it also plays a huge part in overall pelvic stability and how we transfer load and forces from the upper part of our body down through our legs to our feet, as well as from our feet and our legs up through the pelvis into our upper body. So having some good function there can go a long way to help us feeling good. So let's explore this as an experience by starting on our back. And I want to first have us come down onto our backs, feeling the pelvic floor. Now you might find that it might be uncomfortable. So if you find it to be uncomfortable, you can always do this exercise on your belly or even sitting in a chair. So thinking about that pelvis, I want you to maybe even put your fingers together in a diamond. So you've got your index finger and your thumb tips touching like this. So it's like this, and this is the pubic bone, this is your coccyx, the back of it, and then in the middle is where your muscles of the pelvic floor reside, and you've got the orifices along that midline. So use that as an image, and just take a look at that, and imagine that down at the bottom of your body, and then just get a feel for that. And be aware of, maybe take your hands, if it's comfortable, to that pubic area, to your sitting bones, and just place your hand there maybe if it feels safe to do so, if it feels okay, and just get a feel of where that part of your body is. And what I'd like to do next is just take us into a butterfly, so bringing the legs into rotation like this, and then bring them back together. So it's going to look a little like this, and then back together, and do that slowly. And just feel as you move your leg bones in the pelvis and they go wide, what do you feel any difference at all in through your pelvic floor? You might not feel anything. It's just notice what happens in terms of responsiveness between your legs moving and what happens into this midline of your body, into that pelvic floor. And also what happens with your breathing. Because your diaphragm and your pelvic floor connect. So that as we breathe in, they're moving down. As you breathe out, they're moving up, ideally, but they might not be. So just notice what it is that you are experiencing with your own movement and how it feels, what your breath feels like as you do the movement. Okay, so now let's go from here, just do one leg at a time. And notice what it feels like when you do that. Notice when any gripping happens in your back or in your belly or in your rib cage. If this opposite leg that's not moving, if it wants to move over towards the wall, letting that leg move. And maybe even taking your hand to this front of the hip flexor and notice if that hip flexor wants to engage while you're moving that leg bone. Remember, this is a rotation action. And because so the hip flexor doesn't need to fire, and because this leg is moving and it's just one-sided, you might feel more response in your pelvic floor compared to when it was both. Okay, now let's go to the other side. Really, really keep it easy, noticing yourself and how you're breathing. And your pelvis is staying quiet. So you're moving your leg bone only as much as that pelvis just stays easy on the ground. There's no strain and no tension. Your breath is very easy. Good. Okay, and then let that rest. Maybe take your legs straight if you're on your back. And just now feel this middle part of you of the pelvic floor. How that connects to your legs through your pelvis, how your belly feels and your rib cage and your chest. And then slide your right leg over to one side. Now just be conscientious that your pelvis is staying still. And then you're going to take the other leg to follow with it. And then bring the legs back, and then again. Now bring the other side over and have this leg meet it. So you're making the bottom half of a side bend. And then bring the legs back to center. Good. And then again, out to the side. And the pelvis doesn't move as you do this. So you might find that bringing the leg this far is all you can do, not this far. You might also find you can bring this leg further, but the second leg doesn't move very far without getting all strained. So don't move in that strain range. So you're moving, maybe you only move here. And then if all feels good, you can take one arm up alongside your ear to bring the side bend into the upper part of your body now. And again, pay attention to what happens with your pelvic floor. So if as you move this arm up alongside your ear, your pelvic floor started to really wince up or get really, really tight, maybe you went too far. So maybe find the range where that doesn't happen, where there's just a nice and gentle response perhaps, no strain in your body and easy through your breath. The arm comes down, the legs come back. And let's move the other leg over. And then the arm can come up. Maybe you come all the way alongside your ear. But it's not so much about what you are going or in terms of going the full distance. It's really utilizing the awareness of where your body is moving and how it's moving and taking your arm only as far as it makes sense. Then bring that arm back down, bring one leg back and then bring the other. Bend the knees up. And then bring your knees to your belly one at a time and just be mindful of your pelvis. So let pelvis stay quiet. One leg comes up, the other comes up, and gently start to roll those legs in a circle. So as you come in is your exhale. As you come out and away, that's your inhale. Coming in is your exhale. Away is your inhale. And just again, notice and be aware of what's going on through your pelvic floor. The first step to helping your pelvic floor is to be aware of how it's responding in various movements. I've worked with a number of women who have prolapses of varying degrees, and that is a key factor in really assisting them is for them to feel what it feels like in terms of pressure. Because sometimes what will happen is they won't even realize they're overexerting until they feel the pressure of that prolapse. And then they start to learn what overexerting actually feels like. And they can back it off and find what actually makes the most sense in terms of helping them with mobility and strength and stability. So the real key is noticing, right? You've got to take that level of awareness and really play with it and explore it and be curious about it. All right, lovely. Okay, now from here, we're going to roll over and come up into kneeling. And I want to take us into a standing side bend. So we're going to continue this idea of going through to our side. Now, if I've come from here at kneeling and now I'm bringing a leg out, I have to shift my weight over as I bring my other foot up. So there's a little bit of shifting of stability. So notice what's happened between your pelvic floor and your back and through up your torso, and then begin to come to the side. Now, it might be that you bring your arm up, but again, notice what you feel and what you're aware of. And if what your body is suggesting to you that it makes sense, then start to bring that arm up alongside your ear. Or maybe to here. Or maybe to here. But again, notice what happens as you bring your arm up and what it feels like in your pelvic floor. Good. And then coming back up, and be aware of what that happens as the leg moves, and then taking that leg out to the side. And let's take that side bend. Imagine there's a big beach volleyball that you're coming around. Hand is gentle on the leg. And be aware, what's happening now in the pelvic floor here versus when you were here. It's easy just to go into an exercise or a position. And when you can start to draw the relationships, just based through the awareness and what you feel, you begin to piece together more of what contributes to the way that you experience and what you feel and how you're experiencing your symptoms. And then come back up. All right, now we're going to move this way. Okay? And then coming forward into a lunge. And again, notice here what the experience is. One leg forward, one leg back. Two different things happening through the pelvis. Your body is working differently one side than to the other. So as you move forward, notice the relationship between your legs and your pelvic floor. Right? What happens is your leg bone has about 3 to 11 degrees here. So as you move forward, your leg will go into extension relative to your pelvis, but your pelvis will also come into a bit of an anterior tilt. But watch, sometimes people want to drive that motion with their spine because they might not have the movement through this lower part of the body. And that can kind of, what's the word I'm thinking of? It can, I've lost the word, but it can come into the pelvic floor, not necessarily compensate, but it's almost like the energy that's not moving well can come into and sort of sit in that pelvic floor area. I want to say coalesce, but I don't think that's the right word. But the energy can get stuck almost, can become stagnant, and that's sometimes what you might feel in your pelvic floor. So just find the range where you can feel that energy in that area of your body, and then it's not getting stuck. So you might have a lot bigger range, but it might not be the range that really serves you. So really be able to be aware of that movement. Okay, and let's come to the other side. Exploring and feeling. Good. All right, now coming up into standing now. So in standing, come into feet. Feel the bottoms of your feet. And now notice as you bring weight through your standing leg and you shift your weight over, notice how your rib cage feels if there's one wanting to be grip. Notice what's going on through your pelvic floor and start to move and rotate. You don't have to like contract your pelvic floor. Instead, maybe play with, notice the weight coming into the leg and how that pelvic floor responds as you move the leg, as you place the foot. It's really quite that real simple but focused Zen-like experience of what's happening through your pelvic floor. Your pelvic floor will respond. We want it to respond, but notice if you want to make it an anticipatory contraction versus it responding to the way your forces are changing. Coming up into your tree. And each time you move your arms, each time you move your limbs, be aware of how that pelvic floor shifts and changes, how your breath changes and the relationship between them all. Good. And then coming into goddess now, legs wide, rotate the leg bones and let's start to lower down. Sometimes this can be an easier place just to feel this area of your body and relate it or perhaps notice it in concert with the center of your heels, the ball of your foot, and the base of your pinky toe. Maybe take your hands to the outside of the thighs and press the thighs back in your hands and feel what that experience is like through this pelvic floor and also through your torso. Getting more of your outer hip working in through the legs. And then coming on up, rotate one leg. And let's now, keeping the pubic bone and nose in the line, start to move through the hips into triangle. And now notice, as your pelvis begins to move, one side is doing something than the other side. Notice the difference in the experience through that pelvic floor and the orifices through your pelvic floor. And being aware of that, noticing your toes and your feet coming up through your hips, and then other side. This can be really valuable when you're playing around with, say you've got a prolapse, or maybe there's a prostate issue, any other scenario that's impacting you through your pelvic floor. It can be, as you bring that awareness between your various parts, it can highlight some very cool connections. But again, we're bringing this theme of awareness further and further into it, so you've got a little more data and understanding of what's going on in your body. Awareness really is your superpower in this way. Good. And then from here, let's start to lower down and then come down into the floor. And now come back to the floor. And be aware of that pelvis and the pelvic floor, your hips, your legs, coming back into your butterfly. Now notice if anything is new or different. And bring the legs back up. Roll those legs around. And again, being aware of what new or different has arisen. And then from here, letting your legs reach out and just be aware. Notice, connect, and feel the result of the movement with your pelvic floor and any other part of your body, anatomically or physiologically. And you can be here for as long as you would like. And when you're ready, take 5 breaths. And when you finish that 5th breath, rolling on over and then coming on up. Taking this experience with you for the rest of your day. You have a great rest of your day and have an awesome practice. Take good care.